So I have a question for you because I'm a general practitioner, I'm a physician, and I'm also teaching young doctors and students in the medical faculty in in Maribor. And why with the question? Because I would like to start a research about among the physicians. And one of my colleagues was very upset about the research and the survey. And she said, you know, spirituality doesn't have anything to do with medicine. I was really surprised. So I am usually a little bit curious lady, and I start to search, is it true what she said, or maybe not? The first medicine men were priests, and the separation appears around 900 before Christ. And the disease do not only induce bodily changes in sufferers, but affect their emotional state and social interaction. Among others is the spirituality on the origin of this discussion and controversy in modern secular society. But I won't reach on this topic because my colleague will have it in the next lecture. I have sometimes the feeling that we would like to make the spirituality invisible, not only in the medicine, but also in the modern society. So it started with the invitation, it continued with frustration and bitterness, but ended with knowledge and hope. So if we define modern medicine, what is modern medicine? Because medicine was starting with the human being, you know. It's a really old, complex topic and knowledge, maybe a magician thing. But the modern medicine began around 150 years ago. And what was the reason for modern medicine? Everything what is new is always modern. So the researchers, they would like to bring the scientific working methods into practical and theoretical medicine. They have been always pioneers on the fields. So we cannot say that modern is not old in modern way. But in the last 20 years, the medicine is developing really quick. And it's a complex and very diverse society. Sometimes we have a shopping medicine because the people coming and buying every product they have. And sometimes we have the feeling that we are low touch and high tech medicine. The digitalization, robotization, is this really a new reality in medicine? I hope no. And if we look at the medical tree of family medicine, we see that the attitudes, science, and context growing in a big tree. And especially the family medicine. I was 2 days ago in Austria on a conference. We said that the holistic modeling, person-centered care, comprehensive approach, community orientation, and specific problem-solving skill should be in the center of the new age medicine. But still, we are on the conference about spirituality and medicine. If we look at the key aspects of the spirituality, we see that we have the transcendence, meaning and purpose, connectedness, hope, and faith. If we look where we could implement spirituality, that are prevention, recovering from illness, or coping with illness. That means the whole medicine we could cover with positive aspects and benefits of the spirituality in our health and patient and providers. And then I searched the engine, not whole science we have, but look in the last 11 years, how many published, how many articles were published, how many things were written about spirituality and religion and health and medicine. Only in the last 5 years was mostly the half of the publishing materials on the PubMed. And still, my colleague was a surgery, and she didn't like the survey because she said medicine and spirituality doesn't have to do anything together. So I just look a little bit deeper and find that with surgery, we really have only 8 articles. It's not a lot. Maybe she's right, because it's a small amount speaking about spirituality and surgery. But still, we speak a lot about spirituality by the physician, with the patient, in the psychiatric departments, public health, cardiology, nurses and spirituality, palliative care and spirituality. So I think it is an important topic. I have discovered a lot of links between health and religion. It's not only to make positive aspects of the mental health. We could make it objective with the research, with the not qualitative but quantitative methodology, and see that the positive effect of spirituality could be also visible in the body change and in the laboratory results. And we see that we could minimize stress and depression. And we know already that long-term stress or depression cause the same changes like inflammation in our body. We knew that spirituality helps the people in the end of life. We knew that the people could plan and accept death and dying easier if they have linked and they are going or belonging to the group, religious groups, or have a huge or high spirituality. We know that the impact of education should be deeper in the curriculum of medicine, because mostly the young doctors, the residents, have positive attitudes towards spirituality, but they don't have adequate knowledge or skills to care for patients in this area. And we all know that not only the chaplains should be the one to be responsible for the spirituality. Like today, it was already said, in the times of pandemic, it wasn't allowed to have visitors. It wasn't allowed to come to the patient they would like to have spiritual need and helps where they were dying. And it was awful. The people were alone. And later on, we find a connection, we find the tablets. But do we really like to have a tablet when we're dying? Is it not human that they have to be touched when I say goodbye? And the impact of public health, an interesting article from our colleagues from Bosnia, they said that spirituality, healthy spirituality, religiosity and normal nationalism could contribute significantly to public and global mental health. So are we different? Yes, we are. We could be more or less spiritual. We could belong to religion. And it's interesting that it was visible that the people that are going to the church are more social, that they are contributing more to the social well-being. But still, are we different? Yes, we are. Like we saw already by the colleagues, they made a nice survey between 4 countries. We are men and women. We have a different approach. We have a different attitudes. We have a different values, but still we are human beings. And do I have the answer? Yes, I have it. I find out that spirituality and religion are important part of a holistic approach in modern medicine. But we have a lack of knowledge and skills. And I think we should have something more information about the humanity in the medicine. Because also, if the robot is maybe better at the operation, maybe is the digitalization effective because I need it. Maybe the computer could have quicker the diagnosis and the right treatment. But still, I would like to have a human being if I need it, if I'm not healthy. And it's also important that we know that the physician personal values have an influence on the attitudes. It's not possible to have a neutral medicine. The professors would like to teach us we should be neutral, but believe me, it's not so easy. So because of that, I think we should see, we should feel, and we should act in every part of our life, regardless if this is modern or old medicine, because all of us, we are only human beings, and we need sometimes more tech and sometimes more touch. Thank you for the invitation to the organizing committee, and welcome with a question.